Welcome to the Captivate Standard. I'm your host, Ireland Walker. This is the podcast that's setting the bar in all things aesthetics and wellness treatments in Central New York. Let's get into it. Disclaimer: the information discussed in this podcast is for general educational purposes only and is not intended to be specific medical advice for any individual. Always consult a qualified healthcare provider for personalized medical guidance. Welcome back, everyone, to the Captivate Standard Podcast. Today, we're diving into a topic that's transforming the way we approach mental health and emotional healing, which is ketamine therapy. I'm joined today by Dr. Rebecca Reeves, again on the Captivate Standard. You may remember her from episode number 1. She is the medical director and co-founder of Captivate Wellness. And I'm also joined today with Kathleen Niland, who is a longtime employee here at Captivate Wellness. She's an MP, but you're new to the Captivate Standard Podcast. Can you share a little bit about yourself?
Yeah. I'm excited to be here. Thanks for having me.
Of course.
So I graduated from nursing school in 2010. And from that point on, I was working in a hospital. I worked at Strong in Rochester. Then I moved to Boston, worked at Mass General. And then I moved back to Syracuse while I was getting my FNP, so family nurse practitioner. And I was working at Upstate at the time, also going to school there. Graduated from NP school in 2016. And I also work in an oral surgeon's office. And then about 2.5 years ago was when I joined Captivate, started working with Rebecca, running the ketamine therapy program.
And out of curiosity, how did you two meet?
So I actually
through my partner, right?
Yep. So I actually knew Katie just through people.
Got it.
And then we kind of connected, and she asked
Kathleen
me.
knows everyone in Syracuse, so I'm surprised that we hadn't crossed paths. She's famous.
Katie asked me if I'd be interested in ketamine therapy. At that point, I had no clue what ketamine therapy was. I knew ketamine from obviously working in a hospital and just using ketamine. Other than that, it was like, I have no idea what ketamine is. So I came in, shadowed Rebecca a few days, and that's more how I learned about it.
Got it.
And how I got involved.
Okay. And for close friends, we call you Kitty.
Yeah.
So I'll refer to you as Kitty from now on. So Rebecca, I want to just jump right into it. Talk to me about what ketamine therapy is, how you brought it here to Captivate, and how you have become so knowledgeable and involved in it.
Okay. So that's a loaded question. It's
a
lot. But so I have been using ketamine my entire career as an anesthesiologist. It is an FDA approved medication that's been used safely since the 1970s. So it's been around for a long time, and the safety profile is proven. The way I got interested in what we're doing here is by following just the clinical literature in like mental health journals, psychiatry journals. I'm like, wait a second. I was seeing it pop up. I was like, this is an anesthesia drug. What are they using it for? And just became interested and curious. And then the more I kind of dove into it, I was like, wow, this is really effective and this can help a lot of people. But it's kind of tricky because the patient population is not something that I would come across as an anesthesiologist. And, psychiatrists aren't necessarily familiar with how to administer IV ketamine. So, and around this whole time, I was starting to have business discussions with my current partners about, opening a wellness center like this. And it just one day kind of hit me with the things that they were wanting to do and what I had been interested in, curious and learning about with ketamine therapy. And it was like a light bulb went off. I was like, we need to do this. There's no place like it, and including mental health as part of self-care, which is one of our core principles here at Captivate. It just all kind of came together. And from there, I did additional training with the Integrative Psychiatry Institute to learn the protocols and to familiarize myself with the indications, and, really did a lot of continuing education to be able to bring it here safely and, knowing how to use it in an outpatient setting, which is different than what I do in the operating room. And the doses are much smaller. So it was curiosity, I guess, that sparked it. And then just learning more. When I get curious about something, I want to know everything about it.
Yeah.
And then continuing on the formal education path. And then it was growing so quickly, I really needed help. because as you know, I do still practice and I'm medical director of other things here. And so that's when Kitty came into the picture and saved the day. And I just love that she's as passionate about it as I am and can, the commitment she has to our patients in our program. So that's kind of how we started and how we got here.
Got it.
But I'm sure you'll want to dive into more specifics. But
yes. Well, what I'm curious about is the integration of the word therapy with ketamine. So you were talking about using it in anesthesia, but there is a very therapeutic part that is healing. Talk to me about the overlap of the two and how they work together, because I feel like sometimes when people hear the word ketamine, there's a negative connotation and they're unsure about how it could be used safely.
So I think that when we say ketamine therapy, that's it's very, very different, obviously, as Rebecca was saying, than being used in like a hospital anesthesia setting. We are giving much lower doses. We say like sub-anesthetic doses over a longer period of time. So the whole protocol is different than it would be obviously used as an anesthetic.
Mm-hmm. And certainly recreationally,
right.
Which I know there's some negative connotations. So very low dose controlled infusions.
Okay. Yeah. And so we have our own program here, the whole thing. Talk to me about how you were able to curate that and make it happen. How did it get to be where it is right now?
Well, a lot of it is evidence-based. So we're not like kind of creating a new program or testing something out. And this is something that started off at the NIH, and there's been a lot of medical research on it. So we're not making up the protocols as we go along. What we have done is curated our space here and made connections within the community with therapists, like you said, that's an integral part of the program in a patient's long-term success is integrating with therapists. So what we've been doing over the last few years is like the protocol's there and it works really well. It's making those connections within the community to set our patients up for success and making the space here work, because it is extremely big part of the experience is set and setting. And that's what constantly comes up in the literature, is making our patients feel comfortable to do the work that happens during the infusions and afterwards. And so that's what we've been curating, I would say, is the space and the relationships.
Okay. And then talk to me about the space. Why is that so important? And what does our space look like?
It's beautiful. Kitty,
I'll let you take this one. So we have a couple rooms. Each room is set up. I try to tell people. Yep. Private rooms. I try to say like a living room type of setting is what I typically say to people. We try to make it as comfortable as possible for them. When they come in, like Rebecca was saying, the setting's such a huge part of their therapy. We want them to feel safe when they come in here. We want them to feel like they can relax and become somewhat vulnerable, because it is a vulnerable experience. So each person has their private room. We have like a recliner for them. We have different types of blankets they can choose from, weighted, light blanket. We give them music designed for ketamine therapy.
It's a big part of it. Yep.
And I think a lot of it is just also, it's nice having Rebecca and myself, because we are able to kind of build that relationship with the patients, hopefully make them feel safe when they come into this environment, and allow them to have the best experience that they can have and set them up for success.
But it is a very beautiful space, very peaceful. I think we have safety features in place. So the patients are being monitored. We have vital signs monitor. We have infusion pumps. So there's that medical aspect of it, but we kind of try to not hide it, but make it feel like they're not in a hospital.
Yeah.
I mean, a lot of these patients have struggled and been in and out of hospitals, and a hospital setting could be triggering to people. So it's safe, and we have all those medical safety nets in place. But it's beautiful, I think.
It's almost like a spa-like type of setting.
Yeah.
Mm-hmm.
We do have patients say that like when they come in, they don't feel like it's sterile like a hospital. And I think that that's like what we tried to create, a space that didn't feel like they come in and it's like the sterile hospital chair that they're sitting in and they're getting this infusion.
Yeah.
So kind of nice and comfortable and relaxed for them.
We've had patients like ask where we get our blankets from, and then they like buy the blankets to have at home to kind of recreate. And that's a compliment, that they feel safe here, that they want to bring certain aspects of our setting into their home
Into their
environment.
space.
So
Yeah.
that's always a compliment. They're like, where's this chair from? I need this chair for my
Right,
living room. I need this weighted blanket. So
That's funny.
we spent a lot of time on that.
Even the eye masks. They even say that about the eye masks.
Yeah.
They want to get their own for home.
Yeah.
So let's talk about who this is for. So you mentioned that sometimes people have been in and out of hospitals. So this is a different vibe for them that could be triggering for them and make things worse. Can you talk about what type of person would be involved in this type of therapy?
Yeah. So I'd say, we obviously get people from all walks of life, different ages, definitely adult, like 18 plus. And a lot of like in the literature, most of ketamine therapy is studied on treatment resistant patients that have failed multiple traditional depression medications like SSRIs and SNRIs. And so they've failed a lot of different things. And so a patient that has been treatment resistant, patients with a history of trauma that have been treatment resistant to other modalities and medications seem to be very responsive to ketamine therapy. And after seeing and treating these patients, we can understand why there's some unhealed trauma that is probably the root cause of their depression, and medications only work so much or they feel numb. I'm not saying that there isn't a place for them, but so those treatment resistant people are looking for an alternative. And then I would say that we have some people that just want to try something alternative from the beginning. They don't want to be on a daily medication. And so they come here as kind of an alternative. So I would say that's a smaller population. We do have chronic pain patients. So ketamine helps a lot with certain types of pain, very specific pain syndromes. And so that's a different population, a little bit different protocol too. But I would say that covers our kind of like three most common.
I agree. We have like the
PTSD.
the two extremes. We have been seeing more and more veterans lately,
Mm-hmm.
Which is the whole PTSD portion, a lot of that too.
Is there any unlikely clients that you have that people might not think about when they think about someone using or experiencing ketamine therapy? Is there someone or some scenario that's outstanding that you can share?
I think what stands out is I think I was expecting, not being from the psychiatry world or mental health world, I think I was expecting depressed people to like look differently, and they don't. They're like totally normal people that you wouldn't expect are struggling so much. And I think what constantly surprises us, it's like, oh my gosh, like these people are out there functioning and dealing with so much. When we see their screeners, I think a lot of times we're like, oh my gosh, you would never know. And I don't know if that's like a preconceived notion. I was expecting like a depressed person to look a certain way, and they don't. You just don't know what people are struggling with. And I think that's been the most surprising thing is like, wow, people have a lot going on and you don't know necessarily. So,
yeah. And before we talk about what it feels like and everything that comes along with it, just overall, would you say that this is an emotional process for people that you're working through with them?
Definitely. I think a lot of it is their own emotional journey. We're there to support them in any way. We highly encourage that they have a therapist who they're also following up with and integrating with, as we say. But I think for them, it is a lot can come up during each session. It is this whole vulnerability part of things, and working through, especially with our trauma patients, it's a lot to work through. And I think a lot of suppressed emotions can kind of come to the forefront. So definitely emotional. We just try to be there as kind of a support person for them before and after their session, encourage journaling, encourage healthy habits moving forward throughout their series. But it's really each individual's own journey, and everyone experiences it a little differently.
How are you guys able to build trust with patients who come in who have feelings? And, as you were mentioning, this is sometimes a last resort for some people, and they're kind of at a loss. How are you able to have them open up and really divulge into the process?
Oh, that's such a good question. I think Kitty is so good at it. I think it's just setting realistic expectations and explaining the process and being very transparent. You know, these people, a lot of things haven't worked. And so I don't come in and say like ketamine is going to save you. I say, we're seeing very good results. This is what to expect. This is how to best prepare yourself. And I'm always, again, amazed at the trust our patients do give us, because it's such a vulnerable position to be feeling your worst,
Right.
and to put your trust in somebody that you don't know. And so it's always amazes me that we're able to do that. And
but I also think once they start seeing, so after I think their first couple sessions, once they start, especially the first session, everyone comes in very anxious, very nervous. I mean, very normal for them to come in that way. But I think after they get that first session out of the way, after they start seeing some slight changes, hopefully, I think that kind of speaks for then that itself makes them relax a little bit, allows them to open up a little bit more, allows them to kind of let the ketamine journey take it where it's going to take them.
Yeah. And you were just mentioning there, Kitty, the amount of sessions maybe that people have to take. And let's talk about now what our program looks like from start to finish. So you have consultations, you're talking with these people one-on-one, and then there's forms and everything that they have to go through, their records. Let's talk about that.
I would say, so it all starts with a patient reaching out and filling out an intake form that's on our website, or they can call the office and they'll be directed to fill out that form. And that kind of starts the process. We like to have some background information about things that have failed, their medical history, ruling out possible contraindications to ketamine. So patient will fill out this form, and then we'll set up a complimentary phone consult that either Kathleen or I will do. And that's where we really kind of go through their medical history and, make sure there's no contraindications or, any type of lab work or medical clearances that we need. But there really aren't too many contraindications, especially at these low doses. So once we've ruled that out, and then we go through their kind of mental health history, and then we'll discuss the program in the series, because that's how we do it, is a series of usually 6 infusions, sometimes 8 for people that are late responders. And then we will make sure that we have their mental health team on board. Sometimes that involves a conversation with a psychiatrist, a psych NP, or their counselor. And then they decide to move forward, and we schedule the series. It's, like I said, 6 to 8 sessions twice weekly. So it's a big time commitment up front. They're 2-hour appointments. The infusions are about 50 minutes, depending on the indication. Our pain infusions are longer. And then they're coming in twice a week for the infusions. And, we recommend a workbook for people to kind of prepare. We give them a journal to work with afterwards if they're not able to see their therapist right away. And then we recommend at least weekly integration sessions for best results. So that's kind of like an overview of the program, making sure they're a candidate, discussing the program, answering their questions, making sure that, their team is on board and questions are answered, and then bringing them in and doing the infusions. And then we'll do screeners. Like, we do monitor our patients' progress with pretty traditional mental health screeners. So we have a depression screener, an anxiety screener, and a PTSD screener that will have patients fill out in the beginning, before their series, about halfway through, to making sure they're noticing some benefits, and then when they complete their last infusion.
Kitty, can you explain what someone can expect a treatment to be like? My idea maybe is someone, they're people thinking, are they fully awake? Are they not fully awake? Are they able to journal? You were talking about journaling, writing, feeling things. What is it like?
Yeah. So during each ketamine session, during their actual infusion, I would say that they're we put an eye mask on them. So we kind of want decreased stimulation. So we give them an eye mask. We have the blanket. This is actually during the actual infusion. Get them all set up. We have music. Then the music is curated for ketamine therapy. So the music is a huge part of each person's session, and it kind of guides their session for them. So they kind of get nice and relaxed, almost like they're taking a nap. However, they're not actually sleeping. And ketamine's a dissociative anesthetic. So when we say dissociative anesthetic, it kind of removes you from your body in a way. Kind of hard to describe.
Yeah.
So you're experiencing this kind of, like, most people say their sessions are either like peaceful or profound or mystical. I mean, there definitely are some different color aspects that can be seen. Some people with trauma say they like view their life from like a different aspect. None of it should be scary at all. So during their session, are they talking? Are they having a therapist? No, they're not doing that. If I come in and talk to them, say I come in, I usually do like a 15-minute check, touch them. If they're doing good, I tell them to give me a thumbs up. They're able to give me a thumbs up. We do have a call bell in the room. If at any point they needed us, they would be able to press the call button. So it's not like you're thinking they're getting this anesthetic or they're getting this ketamine and they're so out of it. They still, if you interrupt them, they know what's going on. At the end of the session, it does take about 20 minutes for them to kind of like come out of their session. And then at that point is when we typically encourage journaling or talking with someone, something like that. Am I missing anything?
No, I think that was really good. It's very hard to describe the experience, and everyone's experience is so different, and everyone's individual sessions are so different. So it can vary from one session to another, what comes up, what happens, what their kind of takeaway is. I always tell people that it seems like what needs to happen or what needs to come up is what is revealed to the patient. And, sometimes they can see visions, but it's not really about experiencing the external world. It's almost like they're going inward into their subconscious. And that's where they're dissociating from their physical body and going inward to perhaps look at things differently. And that's where we're really seeing. So ketamine works completely different from typical antidepressants. And I don't know if this is a question you were going to ask us, but it works on the glutamate system, not the serotonin system that most people may be familiar with. So glutamate is an excitatory neurotransmitter that is like the learning and change transmitter. And so I love this analogy. If you think about the brain as like, and it's snowing today, so let's use this analogy. The brain is like a snowy field, right? And in depression and actually in a lot of individuals, you use the same path. So the more you walk on the snowy path, the like more like trodden it is, and the deeper that snowy path is. And that's where you'll go every day because that's where you know how to go. Like the path is broken for you, right? So in depression, we see our patients, or we see depressed patients, anxious patients going down these same old pathways, these negative pathways, these unhelpful, like feedback loops that are, causing them to ruminate. And so that's kind of, I think of the brain like that, or our patients that come to us. And ketamine is like a new snowfall, right? So it's going to cover up those pathways that the patients are used to, and it's going to let them have a chance to reset and possibly open some new pathways. Okay. And so I view it as a tool. Yes, it works on the glutamate system. We see pretty immediate and rapid results compared to traditional antidepressants, but it's almost like a reset. It's a new snowfall for patients. So it's an analogy that I think is helpful to think about.
No, I like that. I was envisioning.
And it's snowing today, as usual, in Syracuse. So
it makes sense. So after people have experienced a session or multiple sessions, they have these feelings and they're working through them. How are people working through their feelings and what they are experiencing outside of a session? So are they feeling all of these things, and how are they coping with knowing and healing what they're experiencing, if that makes sense?
Yeah, it makes sense, because some things can come up, and perhaps some repressed things or painful things. What we see a lot is gosh, these people have been through such awful things or terrible things. And it's a reminder that humans are resilient, first of all. And I'm like, wow, the fact that, they got this far, are very successful people,
and also you would never know.
Exactly.
Like you would never, looking at them, you would never know exactly what they're going through, which is also the craziest thing.
The one thing that helps with ketamine that I think, like, if they were going through these things with a therapist and reliving, is that it can be very painful and triggering. But for some reason, with this new snowfall, they're able to experience it or work through it in a non-triggering way or a less painful way than perhaps they would without ketamine therapy, or I know they would if they didn't have ketamine therapy. So I think it helps soften the outlook on some painful or traumatic experiences. And that's where healing can take place. So if they're not as triggered by it, and then again, going down these ruminating negative thoughts and feelings and, kind of their typical day, if they're able to kind of step back from it and be like, okay, I lived that, I survived that. And now I want to heal and move on from it. And so it's helpful to process with a therapist that knows them or that knows how ketamine works in the brain. And so we'll connect people if they don't have a therapist that's familiar or a therapist that's comfortable using this as a tool. And then we love the workbook that we recommend to people. I think part of it is coming in prepared. So patients do have a little like homework on their part as far as like coming in prepared for their sessions. And
to Rebecca's whole part of her analogy with the snow, I also think after your session with all this fresh snow, you kind of have the choice, each patient, individual, to kind of retrain their brain. And that's why that's why we suggest the therapy. That's why we suggest healthy habits during their series and kind of forming these new pathways in your brain.
Exactly.
And getting out of the same one that you've been in and kind of retraining your brain in a way.
Especially for long-term relief, because we see that this works very well in decreasing symptoms in the short term. And we want our patients to have long-term success. And so that means, again, what do you do with the new snow? And how are you processing and moving forward in your daily life after we're finished with the initiation series? And I will say, like, patients do need to come back every once in a while just to kind of dust things off a little bit. But usually we get tremendous results in patients that respond, decrease in their symptoms, and it can be life-changing
for them.
Can you share an example? You don't have to do any specific or anything like that, obviously, but
there's so many.
There's so many. Like, I have chills.
We get goosebumps.
I can see them. You have goosebumps.
It's real results.
Yeah, it is.
And it's life-changing results.
I can say that I've had one patient recently who I think when she came in, she didn't work for years, never thought she was ever going to be able to work again. And then after her series, she was able to get a job. She's decreased a lot of her antidepressants. I don't know if she's on any, and at this point she may only be taking like a little bit of anxiety medicine or something. And she's like completely excelling at her job. Wow. And every time I come back, so she comes back every couple months for what we call like a maintenance or booster infusion. I always like say like, oh, how are things going? This and that. At first, when she told me she was jumping into a job, I was a little nervous because I was like, oh no, like I don't want this to set her back. I hope this isn't too much for her. And every time she comes back, she's like excelling like more and more and more. And she's like, oh, I got a promotion to this. I got a promotion to this. So anyways, it's just like those little things. I mean, saying it doesn't sound like it's so much more gratifying for hearing it.
Individual though.
Yeah, for sure.
We've seen patients with substance abuse problems that are probably just, kind of self-treating with substances because they have this like deep-seated trauma or depression. And we've seen people kind of work through that and come out on the other side like substance free.
Wow.
And so those patients stand out too. There was one that really stands out that had a big epiphany about a death in his family that he never really dealt with, and that he was using to kind of suppress those feelings of losing a sibling so young. And I just remember him saying that during one of his sessions, he was there with her and had this vision of his sister being like, you don't need to do this anymore. I'm okay.
Wow.
And like when they share those stories with you about what happens during their infusion or what, their takeaway is from it, they don't have to share with us, but when they do, and they give you that feedback, you're like, wow, this is something
Incredible.
that's going to change his life forever.
Yeah. Would you say that there is a spiritual aspect to it as well that people encounter, or does that happen?
I think it's possible to happen. I think a lot of it is, I think people, when they come out of their sessions, have this like rush of empathy and like human connectedness, or, again, looking at something from a bird's eye view of their world, their situation, their relationships. And I think it's that can be like an emotional or spiritual experience for people, is just looking at the world outside of their themselves and their
And being in
problems
it.
and their exactly. Yeah. It's hard to put to words a lot of this. We're doing our best.
Yes. Kitty, can you share what typical results look like for a patient using ketamine therapy here?
So how we kind of base the results is that we, as Rebecca was talking earlier, we do our screeners before they have any ketamine, halfway through their series, and then before their last session. And I tell people, it's the only objective way as us as the provider and them as the patient can kind of see it, like track any objective results.
Yeah.
So I'd say typically what we see is on average 70% symptom reduction is what we usually say.
With depression, for sure.
With depression. Anxiety can be a little bit less. However, I do think that anxiety and depression go hand in hand. Once you lift one, the other one kind of follows along with it. So typically on average, I'd say about 70% symptom reduction. And then at that point, obviously we have some people who see, much greater results. We have some people who may not see as good of results, but I do think all of our patients do see some type of symptom reduction. It just varies on how much.
I would say that's very accurate. So the reason we do the assessment, Ireland, halfway through is we know a lot of patients are unfortunately paying out of pocket for this. And we want to make sure that they're seeing some benefits, whether that's better sleep, better energy, small functional improvements are usually what we see first. And so we like to reassess halfway and make sure they're noticing some benefit. And I would say over 95% of our patients choose to continue. We have a brief reassessment period after, halfway through with our screener, and look, we're seeing some benefits, and almost everybody decides to complete the entire series. And that's showing us that they're definitely noticing some benefits. So yes, it's an objective way that we can evaluate. The patients can see the results, because sometimes when you're in it, you're not they're not necessarily objective,
right?
But that's the best we have, our screeners, and then we share those results, obviously getting a HIPAA release, but with their mental health team. And that's a way to also track long-term progress, if they're seeing their mental health therapist or psychiatrist or whomever is following them, they can reassess their screeners and say, okay, maybe it's time for a maintenance session, or just a way to kind of long-term keep track of their progress too.
Okay. And then I'm not sure if we talked about this, but when people are here, they can have family or friends surrounded by them. Do you want to talk about, are waiting for them rather after they're done with their session, they come out and.
Yeah. So we, obviously our space down here, like we were saying earlier, is beautiful. We do offer patients to have a support person in the room. If someone wants a support person in the room, more than welcome to. We just ask that their support person is quiet and respectful throughout the session. We have a nice big waiting area down in our ketamine space, so they're more than welcome to relax their relax in our ketamine space and wait for them as well. Or some people choose to wait in the car. That's also fine as well. I mean, so if they want their support person or their driver to wait in the car, that's fine too. Therapy wise, typically during your session, it's not like you're sitting there having a therapy session. That's why we ask the support person to be quiet in the room. But after the session, if they want to sit with someone, talk with someone, more than welcome to. I don't know if that answers your question.
We really don't want somebody distracting them during the infusion because, again, they have their eye mask on, they have the music, they're going inward. So, anyone kind of detracting from that or like, constantly, interrupting or interacting, even interactions, brief interactions can pull people out of it.
And I think that's also the same with us. So we will do like a 15-minute check on our patients. But after that, as we discuss it beforehand with our patient, if they're fine, we just try to let them be too, because we also don't want to pull them out of it either.
Okay.
But we're constantly checking their vital signs and watching them during the infusion. So it's not like they're not being observed or monitored.
Okay.
So it's just that we're not, also
we're not sitting in the room staring at them,
right,
touching them, asking them how they're doing. Yeah.
Okay.
I do also, to make note, one important thing too is that there's different forms of ketamine. So obviously we do IV ketamine here, which we believe is the gold standard. I think if you do your research, you'll find that. But there's also different forms. So there's like the nasal ketamine, there's oral ketamine. And with the IV ketamine, we're lucky because we get to draw up each individual specific dose to a specific milligram. And then we know what they're absorbing. When you do the nasal ketamine, there can be many variables. If you're congested, if you're lying down, there's only straight doses. Oral ketamine, there's only like certain doses, like
jumps,
100 milligrams, like whatever. So with the IV ketamine, we can be very exact with each dose and each milligram that we're pulling up.
Very individualized, the dosing. And I think that definitely is key. And then when you look at different pharmacodynamics that I won't get into exacts, but when you give something intravenously, that is the dose that's going to be effective that your central nervous system and your brain see. When you take something orally, what we call bioavailability is not 100% like it is for IV. So the dosing that we give, you maybe you get half of it. Maybe some people have better absorption than others, and it's not as well studied and it's not as exact as what we're doing with intravenous. So I think people are like, wow, intravenous, that seems like
intense,
crazy and intense. It's actually more controlled. And you don't see these spikes. Like when you swallow a pill orally, when your body absorbs it, you're going to get a spike and then a drop. With this, again,
steady, slow and steady.
And that's
key. Is there anything else you want to talk about post program before we get into any misconceptions or anything else that I want to touch on? So following a program, someone has completed all their sessions. You did talk about them following up with you and talking with you and coming back for maybe another session later down the road, but anything else, any outpatient things that people are doing that you want to mention?
So I would just say after your series, we do the 6 to 8 sessions, as we've already covered. And then booster maintenance doses are typically something that most patients will need. We do a 2-week follow-up phone call, but we also suggest our patients make an appointment for like 4 to 6 weeks after their initiation series. I always say if you're feeling great, you can cancel it. But in
Just
the
to have it
beginning,
on the books.
in the beginning, I think after the series, what we found over time is that keeping a couple sessions closer, not like, a year out or something like that, has been beneficial for long-term effects for our patient. So we hopefully see them back. For most patients require base maintenance or booster doses. Initiation series, I always tell people, very well researched. The 6 to 8 sessions over the 3 weeks, very well researched. The maintenance booster doses aren't as well researched because they're so subjective per individual. But on average, I think we see people back every 3 to 4 months, would you say?
I say like quarterly. Chronic pain patients are different just altogether. We could do probably a whole episode on chronic pain and ketamine. They need to be more frequent because it's not a cure for the chronic pain. It's a, it's a treatment modality. So it's different, but I would say like 60 to 70% of our patients will require some type of maintenance. And then a typical, like window is
3 to 4
months, I would say. But yeah, we like to have, especially right after they finish and they're feeling well, that 2-week follow-up is important. Sending their results to their team is important. So they're not like lost to follow up. And then it's nice to have their first maintenance session booked.
And we just don't want them to regress either. So I think that's the big thing is making sure they have a therapist lined up or, a psychiatrist, something like that. And knowing that they have the support system outside of their mental health team as well to kind of, if they're noticing any changes, kind of suggest a maintenance or booster dose. Because a lot of times it's someone else noticing it first.
Right.
Okay. And then let's talk about misconceptions. What are the things that you're hearing from maybe social media, people that want to try that maybe end up not doing it, or anything you hear that you want to kind of debunk about ketamine therapy?
I think there's so much information. Obviously, we hear about it in the news. We heard about it with Matthew Perry. You hear about recreational use, and that's just not what we're doing here. I mean, there's nothing about this is recreational. It's very controlled. Again, our dosing is different. Our route of administration is different. Our whole process of integration. And so I would say this happens to me. It's happened before with propofol, a medication I use in the operating room that was abused by Michael Jackson. And it's like these very good, safe medications are, getting a bad rap, unfortunately, because people are using them incorrectly. So I feel like I answer this question all the time. We use propofol safely all the time. It's one of the best anesthetic medications. Just don't go home and give it to yourself to go to sleep at night. Obviously. So it's all about safety and dose and setting and the experience. And we're not trying to get people high here. We're not trying to
or like hooked or anything like that.
Yeah. I mean, this is an intense experience for a lot of people. Like, it's not fun. So
I will say that most of our patients are leaving saying that they're like, ketamine takes a lot out of you. It's not just like you come in and you're like, have this like nice, like little trippy thing that people that maybe like recreational you think about or something. And people at the end, they're happy their series is over because like mentally, physically, it takes a lot out of them every single time. It's an emotional experience. It's not like they're looking forward to being like, I want to like run into my next appointment because it does. Yeah, they see the benefits. So they do keep coming back, but I think it does take a lot out of them.
Okay.
But along with the stigma, I think that, I mean, I don't know. It's a hard thing to talk about almost because I always think like whenever I tell anyone like, oh, what do you do? Oh, I do ketamine. And then you never know what someone's thinking. And they can just look at you and you're like, well, they don't really, they're misinformed.
They're misinformed. And I actually love when I can have that experience with somebody that you can tell they're like, whoa, what are you doing? Like what's happening here? It's evidence-based, it's well-studied, it's controlled. I feel good about our program and the way that we're doing it here and the results we're seeing. So I love to talk about it and give people their perspective of like, what do you know about it? What is your apprehension? What have you heard? And, certainly educating is a big part of our job as this is new to the area, I would say. Obviously we've been around for a few years, but and I think just the way that we're doing it, I love to talk to people about it.
Yeah. And so is there any other places around here that are doing what you guys are doing? Because I want to ask you about the future of ketamine therapy and how it works with the mental health field and what you see for the future, where it's going, what you're excited about. But as far as right here in Central New York, is there anyone else or anything else happening like this around?
I think as far as I know, there is not an inpatient program at upstate, but I believe that they're doing chronic pain treatments in the hospital. I think they're outpatient treatments, but they're going in. And I know they're extremely backed up for these chronic pain infusions. The infusions take longer. It is, we can only do so many of them in our clinic here. I'll say I'm excited to collaborate more with the mental health community around here. I think it's new to them too. And I'm always like, we're open door policy. Come in, look around, talk to us. We'll open our policies. We'll show you how we're doing it here. As people that have not been in the mental health space that are, trying to meet people and educate. I'm excited about that. And a lot of people have embraced us and do want to learn what we're doing here and have referred patients. My hope for the future is that it's more accessible. There's a lot of barriers as far as having a support system to get you home from the appointments, to be able to take time off of work, in 3-week periods. And we'll sign whatever FMLA paperwork we need to do. But the cost, I would give it to everybody for free. I think everyone knows that. But, and we're seeing some insurance reimbursement, but I think there's a lot of work to do there because it's so effective, but it's often not fully covered
which is a lot of mental health, unfortunately.
Yeah.
I think cost is, people do want to know what it costs. And because it is an, out of pocket expense, especially upfront, especially, and then they can try to see if we'll provide a bill so they can submit to their insurance and hopefully get some reimbursement. I tell people to call their insurance first if they're relying on that to see if it would be covered and, if there's any way we can help with, making sure they have the documentation they need. But each session is $450. And so that's a lot of money in a short amount of time. We do have interest-free financing options and, we have military discounts
but you say that every minute and second that you are experiencing this is making it worth your while, you would say.
That's what I wish I could tell people is that it's an investment in yourself, your mental health, your future, your happiness. Like to me, I know it's a lot of money, but if someone could tell me that I was going to have 50 to 70% improvement in my depression symptoms and no suicidal thoughts, like to me, I was like, that would be everything,
Yeah.
I always say if I had a family member who was really struggling and they had the financial means to do ketamine therapy, like I would 100% suggest that because I mean, it's also easy for me to say because I see the results all the time.
Yeah.
But you can just see how life-changing and transformative it is for these patients.
Yeah. Anything else that you're excited about for the future of ketamine therapy? I know that there's more science coming out and research and things that are backed and studies coming out. Anything else that you are excited about?
The mental health field is evolving so much. And I know I'm continue to be amazed by the therapists that we work with that in the research around different therapy techniques and EMDR and like other modalities, TMS, I was always interested in psychiatry in medical school, but I felt like I didn't love the treatment options. Like try this medication. If this doesn't work, increase the dose or switch to this medication and, all this waiting time in between. I'm somebody that likes, like immediate results or, that, if someone's struggling that much, like why do we have to wait 6 months to see if a medication works? Or, when the last resort has been electroconvulsive therapy for so long, like, is there something better? And so I'm encouraged by, the new research in psychiatry, the new treatment modalities, the psychiatric community being open to these new modalities and recommending it. And so I think that that's exciting. It's evolving in a field that perhaps from my own perspective seemed to be stagnant, at least when I was going through my medical training. So,
yeah. And you would say that most people in that space are open to ketamine therapy.
I think we have educating to do. And, that falls on us as being one of the only clinics around here. People are skeptical, maybe how are you telling me this would work so quickly in somebody that has been so resistant? I'm like, does.
And I even think psychiatrists, they can read the literature, but also ketamine is not, as we talked about, it's not a typical antidepressant. So them learning about ketamine, that's a whole new thing for them. So it really is a big part of just even educating them. And maybe them seeing results of some of our patients. And then
I tell them, I'm like, the only way to truly understand it is to experience it yourself too. I'm like, come here, come
and see.
come and see. Come
Yeah.
and see what we're doing. I think and I invite every psychiatrist I talk to, come in our space, see what we're doing. You can look at our results. You can see what our patients are experiencing.
So for someone listening who's maybe on the fence about trying ketamine therapy, they're interested in it, they're curious, what is the first step that you recommend that they take to learn more?
The first step is to, like, if they don't feel comfortable calling or filling out the intake form on our website, which is the typical first step of how you would get, the conversation with Kathleen or myself, to call the office and we can make some time, for a quick phone call if somebody's like really apprehensive or, some people are paranoid about filling out forms and understanding that we are a medical company. We don't share that information. It goes into their medical record just as if they were going to their doctor's office. So it doesn't lock you into anything. You're not committing to anything. We need to make sure that you're a good candidate and that you have the right support for the program. And then a lot of times they need to like talk about it with their significant other, their family, their mental health team. And so it's just a conversation.
Awesome. Okay. Well,
Thanks for having us.
Yes. Thank you so much for coming on to the podcast. I think we'll maybe see you guys again on another episode, hopefully. But for now, thanks.
Thank you.
Thank you.